In health news tonight, a new therapy for a rare, devastating genetic disorder.
And it can be life-threatening for people diagnosed with it. News 8's medical reporter Jocelyn Memento live tonight in our New Haven newsroom with the very latest on treatment now being offered at Yale New Haven Hospital. Jocelyn?
And I'm talking about Gaucher disease, estimated to affect 1 in 40 to 60,000 people and often misdiagnosed. Early diagnosis leads to early treatment and prevention of dangerous complications, which now includes the first oral medication.
Tamara Siosi was just 18 months old when she broke her hip.
At the time, it was written off as a really freak accident.
Years of chronic bone pain, weakened immune system, and an enlarged liver and spleen baffled doctors.
They would speculate maybe it's an autoimmune disease, maybe it's rheumatoid arthritis. Some people thought I had leukemia.
Finally came the diagnosis of Gaucher disease, a rare inherited condition due to a defective enzyme whose job is to break down fatty substances.
When the enzyme is low, the lipid material that is normally broken down by this cell begins to accumulate in cells of the body.
In Tamara's case, it led to an abnormal sized spleen and liver.
Massive enlargement of the liver and massive enlargement of the spleen here.
20 times larger than normal, and a bone marrow not making new blood cells. The FDA recently approved the first oral drug for Gaucher, and well-known specialist Dr. Pram Mistry at Yale New Haven Hospital, lead investigator of a clinical trial that investigated the drug, is now able to offer it to patients like Tamara.
This is a drug that reduces the amount of the lipid that accumulates in Gaucher disease by inhibiting its production. And uniquely, this is a treatment that affects all cell types of the body.
Now the size of Tamara's spleen and liver have shrunk considerably. So has the bone marrow. A welcome treatment after 20 years of enzyme replacement every 2 weeks.
They would say, I don't know if she's going to make it to 30, and then I don't know if she's going to make it to 40. But then with enzyme replacement and now Sardelga, it's rewritten where I'm at now.
A wife and mother of 2.
In spite of cycles of fatigue and bone pain, I would say overall I'm doing a lot better, and I feel that I'm a lot more present in my life.
A complication of Gaucher disease is that patients can go on to develop blood cancers, notably multiple myeloma. Dr. Mistry tells me this particular drug will help lower the risk of that happening. He says the research behind this rare disease has provided medical science with a roadmap for treating other diseases. Anne?